Hi everyone, welcome back to Daytime York Region. Today we're talking about a new program called My Nurse Health Check. Now it started from a company called Bayshore Home Health located in Markham. The regional office is in Markham here, and we're pleased to welcome Julie Adams. She's a spokesperson for My Nurse Health Check. Welcome to the show, Julie.
Thanks for having me.
So when did the Markham branch of Bayshore Home Health decide to start My Nurse Health Check, and what do you do with that program?
My Nurse was actually launched through our national office, which is based out of Mississauga, but we do see clients through the My Nurse program in York Region and across southwestern Ontario, and it's been going since about last September.
Wow. So it's in its first year.
Yes.
Who is the sort of service provided for? Is there a typical person that should be contacting you for the service?
It's geared towards mostly to seniors, but anyone is eligible for the program. It's geared towards individuals who want to be more proactive about their health and who are interested in living in their homes longer and living independently.
Yeah.
So, needless to say, I'm sure a lot of the population that you see is older.
Generally,
seniors in their homes. Who do you have calling? Is it the seniors or is it their family members who see the fit?
In my experience, it has been mostly daughters of seniors, and in a lot of cases, being that we're GTA, it's such a large area, oftentimes it's the children that are living farther away from their parents. So it's a way to keep connected to their parents' health, and you can actually have the family, with the permission of the client, of course, receive health information, sort of status updates, so that the kids can be more in touch with what's going on with their parents.
Well, I imagine
That's great.
It helps the family as well. I mean, if you have, or caring for your mother or father who is sick at home, I mean, this provides an opportunity to be able to go to work and still have someone take care of them properly.
Yes, and the My Nurse part is it's an ongoing wellness program, so it's not necessarily where a nurse is going in and completing one task. They're going in and they're doing an overall check on their well-being. It's a physical assessment, they're doing a nutrition review, they're looking at their medications. It's sort of the bigger picture and catching things before they happen. So if there might be an issue with their medication, the nurse going in once a month can see, oh, Mr. Smith isn't taking his medication properly, so let's get that resolved. If they go in, though, and see what you're talking about, Jeff, is if, let's say, the My nurse goes in the home and sees that they need extra services, they might need a personal support worker to help them with a bath every day or to get them out and about, then we can also offer that as well.
Oh, that's great. So you do the first initial consultation or health check, and as we know, health and wellness is a lifelong journey. It's not a one-time thing. So then you go in monthly.
Yes.
To do a checkup.
Yep.
What kind of peace of mind does that give? And you know, it sort of empowers the family so that they have more information about their parents who they might not see every day.
Exactly, and that is the peace of mind, is that they're going in monthly or quarterly, they're catching things before they happen, they're catching any illnesses or issues, maybe mom or dad isn't eating properly. Well, when they call their mom, they're saying, oh yes, I had a full meal. Meanwhile, they've had a half of a peanut butter sandwich. So this way, they're having that monitoring, ongoing monitoring, and with the reports that are available to the family, then they get that at the end of the month or as required, really. And the My Nurse nurse also works with the family doctor if there are any concerns, so we get involved with the whole picture of the care.
And
That's
of course,
great.
all the nurses are fully registered, and there's no worries at all there.
Right, they are registered nurses, yes.
So what sort of concerns do you see the most when it comes to the health of some of these elderly? What sort of things, conditions, or, you know?
One of the main issues is that, and one of the key reasons why we had decided to launch the program is there are a lot of mobility issues. So seniors can't get out to the doctor. They may be using a walker, be confined to a wheelchair. Arranging transportation can be difficult, not to mention with children living further away. You know, they're looking at taking time off work. A lot of companies, you know, can't permit time for appointments for parents. So, you know, they're looking at that issue too. So a lot of individuals are tied to their homes. So by having the My Nurse visit, It can often, it doesn't replace the family doctor, but it can maybe mean less visits with the family doctor by having the nurse in place.
I imagine with an aging, booming population as well, this is probably going to become a service that is going to be much, much more in demand, isn't it?
Yes, definitely. And we've seen over the year more and more people are signing up for it.
It's also good to have a record. You know, we don't really have records in our possession. Our doctor has his file, but this gives them a way to keep a file on the individual, and you can always access it with all that information. When should people start to look into this service, or, you know, is there any indication that they should be giving you a call?
You can look into the service really at any point. We'll come out and do a complimentary consultation to see if it's the right program for you. Really, because it is a proactive approach, you can start it at any point in time. We have a lot of individuals that are really quite healthy, and they're just looking at maintaining their health status as opposed to declining, so they sign up for it. And then we have others who are in more of a crisis situation, so we go in and act in a case management role and service them with their medical issues as well.
It's good. It's convenient. It's at your own home, and you don't have to go through all that booking appointments with the doctor and waiting, and you know, it's good. Now, what does Bayshore Home Health do?
Bayshore Home Health is a home care provider. We've been providing in-home health services, anything ranging from like light cleaning and laundry to full complex nursing. We can do round-the-clock care with registered staff. The company has been in business since 1966, and we have over 50 branches across Canada. As well, we do community, we have community care clinics, so individuals don't have to go down to hospital to have infusion treatments, other types of therapies. They can have it in their own community.
That's great. So how do people get in contact with the My Nurse program?
We do have a website, and it's mynursehealthcheck.com, and there's also a toll-free number.
Oh, okay. Do you know that number?
Not offhand.
It's on the website.
On the website.
That's why I love websites. Go to the website for more information. We'll be right back with more on Daytime. Don't go anywhere.